Real good. Testing, testing, 1, 2, 3. And one more time. Testing, testing, 1, 2, 3. We good to go? Yeah. Okay. Hello, everyone, and welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. For over 2 decades, eLotus has been your trusted source of TCM continuing education for acupuncturists. We offer the largest selection of online CE courses with over 3,000 CE hours. And if you are new to eLotus, remember to sign up today for an eLotus account to receive a free 1 CE course as a welcome gift. This offer is valid for new accounts only. Let's stay connected. Look for us on Facebook and Instagram for TCM tips and promotion. Just search eLotus.org. And join our email list to be the first to receive specials and announcements. Did you know that we recently published an article on the formula Xiao Chai Hu Tang? After this webinar, we encourage you to visit our article page to learn something new. All right, so let's go ahead and start today's class on managing chemotherapy side effects with TCM with Dr. Huabing Wen. Dr. Wen currently owns a private practice of over 20 years and serves as a faculty member of the master's programs at both Yosan University of Traditional Chinese Medicine and Emperor's College of Oriental Medicine. He holds classes in TCM Oncology, Advanced Chinese Internal Medicine, and Chinese Classics in extensive knowledge of both traditional Chinese medicine and conventional medicine. Dr. Wen provides the best possible care for his patients and treats a broad range of diseases in collaboration with a wide variety of health professionals. So at this time, let's go ahead and give Dr. Wen a big welcome. Dr. Wen, you can go ahead and share your PowerPoint. I'll stop mine and you can begin.
Thank you. Not letting me.
Perfect.
Oh, okay. No. Well, technology, what can you say? Yeah. So thank you, everybody, for coming. So we're going to talk about managing chemotherapy side effects with TCM. Yeah. So this is so like Donna mentioned, I've been teaching at the USAN Emperor's College for quite some time for both their master and doctoral program. So one of my topic is always, the oncology part. So I'll probably start with a newer concept called the integrative oncology. This is basically, it's like a TCM oncology plus conventional medicine. Yeah, so that's what there is a International Society of Integrative Oncology. Yeah, so they have conferences like every other year, pretty much around the world. If you are interested in more, so you can probably check them out. Yeah, so they have publications. They have. So the point is, that the oncology, the common, just in conventional medicine. So the oncology practice is not barely enough to meet the patient needs. So there's a great room for other modalities. Yeah. So Chinese medicine, happen to be one of the best, way to fill that void. Yeah. So you pretty much have a combination, so that some of the conditions, chemotherapy can be more effective, but with a lot of side effects. So you can use Chinese medicine to take care of the side effects. And so that way, so that you can make a better, more complete treatment. So the TCM approach, and pretty much we use that for chemo, radiation, and also the most recent, the immune therapy. So this is you see more and more the collaboration. And I'm sure some of you may have seen a lot of cancer patients. Others may not seen that many. And the one question I always hear from my student is like, you feel, number one, it's overwhelming. Yeah, so seems like look at the cancer patients have so many issues wrong. For example, a typical case of during chemotherapy, you could have issues with the GI tract. Yeah, there's nausea, vomiting, no appetite, diarrhea, water retention. You could have the skin rash. Yeah, you could have peripheral neuropathy, the feet, and also there's a common condition called like chemo brain. So you could have so many symptoms, yeah, at the same time. So that make the diagnosis, even by TCM standard, the pattern differentiation more difficult. So that's why it's like you always feel overwhelmed. Where should I go? Where should I start? What approach should I use? Number one. Number two, and also that in conventional medicine, and especially in oncology, so most of the doctors, the oncologists, because they're not familiar with herbs, with acupuncture right now is actually a different story. It's pretty much most of the oncologists that I have encountered, they're pretty much all for do it, to help with the neuropathy, help with the pain, but yeah, so they're okay. But the herbs, so they kind of like very, some of them are very strict. Yeah, stop. What I tell patients normally, like, just stop all the herbs. And so that make it a little bit hard, for practitioners, to basically to do. So like, okay, patient is getting the caught in the middle. So like, okay, and some of my patients come in and say, I don't need to let them know what I'm taking as long as I feel good. Yeah. So this is unfortunately, this is reality. But my attitude is always like, okay, if that's the case, if you have a concern, let me talk to your oncologist. I can probably explain better what the patient is using and what it's used for. Yeah. So that way, we can basically cut the misunderstanding. So make sure there's no overlapping, too much of overlapping. And so one example is that, yeah, it's like the doctor, oncologist most times is like they're afraid, yeah, the interference from herbs that may cause problems with chemotherapy. And so first, yeah, you need to also let the doctor know, yeah. So if the patient is taking chemotherapy, we're not going to use any like the herbal chemotherapy. I call that, it's like, okay, so talking about herbs in general, when it comes to oncology, there's a two group of herbs, all right? Group one, anti-cancer herbs. Group two, others, right? So the anti-cancer herbs, the commonly used ones, we have about probably 40, 50. Yeah, they're very specific. They act pretty much like chemotherapy, but not as harsh. Yeah, so they have their place. Yeah, for that. Yeah, this is so. The first thing is like, okay, let the doctor know patients are already using under chemotherapy, ongoing chemotherapy. So there won't be any other herbal chemo there. So the herbs you're going to use only for one, the side effects of the chemo. Let's see. Okay, this is for GI support. All right, so that is for basically just because fatigue is another common side effects from chemo. Yeah, so to support, basically lift, yeah, give the patient more energy, yeah, and support the immune system, support the adrenal function. Yeah. So you have a focus. So let them know they're not overlapping, and what we use is not interfering with, yeah, the chemotherapy. So that you'll actually have a better way to communicate. Yeah. And this is also the approach, yeah, we use. Yeah, it's like, okay, make sure which stage use what. Yeah, so that's a very important question. And the integrated oncology is pretty much like a more comprehensive approach. Yeah, you can basically get the like unique, yeah, combo. One area missing from conventional medicine perspective, we can make it up from the TCM perspective. So you have this each stage, because in conventional medicine, let's see, the chemo treatment, we're talking about before the pre-chemo care, and during chemo treatment, there's another approach, and also post-chemo. So most times, the leftover side effects, for example, like peripheral neuropathy and all that, so you have a different approach. But through the whole, all stages, focusing on the immune system, that is probably the most important part. That is what in TCM, right, we call to improve, to increase the Qi. So that is the language we use, different language, but that is pretty much the same thing. So the integrative oncology is that in all the conditions we're talking about, precancerous conditions, and we're talking about people have HPV, chronic infection, or they already have like precancerous changes, skin cancer, precancerous type, and also other nodules, so that is that group, and the side effects of the conventional treatment. So this is another area that we'll talk some more, about that today. And if they have failed conventional treatment, talking about like, okay, so they're done with the chemotherapy, and so you hear sometimes say, oh, that's it, so there's nothing more to offer. And that is the time normally if patient come to me, we say, oh, we'll start with the herbal chemo. So we can work from a different angle. The herbal chemo is not like the regular chemo. So we have some very good results actually, from just doing that. In remission, so this is the part, and in conventional medicine, it's just the checkup, right? Every 3 months, first year, 6 months, every 6 months, the second year, annually after third year. And so, but from TCM perspective, even they're in remission, if their pattern hasn't changed much. For example, we're talking about what causes cancer in the first place from TCM perspective. There's one common pattern, which is yang deficiency with cold toxin. You translate that into conventional medicine, chronic inflammation. So right now, even in conventional medicine, so chronic inflammation, is a very hot topic to study, because that turn into cancer. That's a very high percentage. Different type of cancer, you may have different data. But for example, pancreatic cancer, and it's about like 80% of the pancreatic cancer, they have a history of chronic pancreatitis. And unfortunately, most of those chronic pancreatitis patients, they don't know they have. So that diagnosis is being pretty much being way too low than it should be. People blame, oh, this is a stomach issue. They feel like they always have a stomach issue, get bloated easily for no reason, and so that is a pancreas issue. So with the chronic pancreatitis, if you don't take care of it, 10 to 15 years later, that may turn into chronic, like pancreatic cancer. So that's just one example. So that even in remission, if you don't solve the problem, and so that basically, just make the recurrence more likely. So you have to address, sometimes that we use in TCM, we use the term, you have to change the constitution, right? So change the constitution means you probably need to monitor, monitor it or pretty much manipulate, even from a deeper level, the essence level, to change how the body functions. And the last part, prevention, and what type of lifestyle should we do, try to prevent the cancer from coming back. And in conventional medicine, that is still a very general. Yeah, eating probably eating healthy, take care of stress. Those are good, but not specific enough. Yeah, so different type of cancer, and it requires a different type of lifestyle modification. Yeah, so that's the that whole idea. Even prevention, should be individualized and should be personalized. So this is kind of like when you try to use integrative oncology model, that you can take care of both because you look at it from both. Yeah, so you have much better understanding of what's going on. So we're talking about the commonly used, herbal medicine. Yeah, it's still the majority. Yeah, and when it comes to cancer care, and acupuncture, for the side effects. Yeah, and especially like neuropathy and pain management. Yeah, that's a very good one. Nutrition, we talk about under the prevention, perspective. So what type of food in general, yeah, and so that in Chinese medicine is the sour flavor. Yeah, actually we know that sour flavor actually means more alkaline. Yeah, so that actually is the same thing we're talking about in how to reduce inflammation. Yeah, by increase the alkaline environment, especially microenvironment. Yeah, so to change to reduce inflammation. Emotional support. So that's easy to understand, right? Yeah, stress alone can be the single risk factor, causing cancer. So that's Tai Chi and the Qigong and the other type of exercise. Yeah, so that basically get the Qi and the blood circulating. That's from that angle, right? So when you look at from conventional treatment versus the TCM treatment, conventional treatment is always disease focused. Okay, so pretty much all lung cancer, yeah, the treatment is all pretty much the same. Yeah, so right now it's a little bit different because of immune therapy. Yeah, so they can check the defect the genes, that. So to combine that immune therapy, they have about like 20 different, so-called new treatment. But you look at that, chemotherapy is like for the evil qi. The immune therapy is for the righteous qi. So combination, to increase the righteous qi to eliminate evil qi. It's very much like a TCM model, TCM like. That's what we've been trying to do all the time from the very beginning, right? And TCM approach, patient focused. So that's like have to be individualized and personalized, and so you have to have that model. One example is, okay, a lot of people after chemotherapy, they have diarrhea, they have loose dose diarrhea, poor appetite, and so we use 火香正气散. Later we'll talk more about that. Yeah, but some people, actually the same chemotherapy that develop constipation. Yeah, so we use 桃核承气汤, the pitch pit, 承气汤. So this is like, okay, you have to be based on their pattern. Yeah, even though the same evil qi, the same type of evil qi, and so the body may manifest as a different pattern. So you have to always go by that. So it's like a patient focused and individualized and personalized approach. So the TCM perspective is always, that we're talking about cancer treatment is a little bit different from other conditions. So even though, the consensus in conventional medicine right now, you pretty much treat the cancer like chronic disease. Yeah. So the thinking has shifted from eliminate the cancer to you can basically survive with cancer, like a coexistence. Yeah. So make sure the evil qi is not too severe, and your righteous qi is always one step ahead. So you can keep the evil qi at the bay. You can balance it. That is pretty much the approach. Yeah. So in TCM, the yin pattern versus the yang pattern. So this is basically the evaluation, assessment of how much toxin versus how much deficiency. So that balance is first thing first, always keep that in mind. And because they may already finished chemotherapy, but they still have a lot of excess. Instead of using tonics, you need to use like purging, eliminating, reducing approach. So this is the yin and yang pattern is always okay with yang represent the righteous qi, yin represent the evil qi. So that assessment, that through the whole course of treatment, that is the first thing first. And the branch versus the pattern versus the root pattern. And you may more likely to see a combined approach, combined pattern, more complexity. Within one case, you may see 4 or 5 sometimes different patterns. So that become very important. So to basically to identify, not just the root cause, root pattern versus the branch pattern, and which pattern is more dominant. So that needs to be taken care of. So this is another way. So evil qi versus righteous qi. That's you hear that a lot. Patient under chemotherapy, and so one day say, oh no, the doctor said because their white blood cells too low, their platelets too low, red blood too low, they cannot have chemo, right? They have to skip a month around the wait for a couple of weeks and to do it again. So that is the time to use qi tonics, blood tonics, yang tonics to basically rebuild the system. That's and cold versus heat. And interesting enough, most cancer patients, what you see is the combination. They have cold, they also have heat. So a lot of those patterns, normally you don't see them together. You may see them in cancer patient. For example, we have seen people with, because normally when you have a dryness, you won't have like water retention. But in cancer patient, you see that pattern. You have dryness and damp same time. You have a cold and heat same time. And you may have yin and yang deficiency same time. Qi and blood deficiency same time. So that makes the patterns can be very, very complicated. But the key point is like, you can just focus on one pattern at a time. So you don't have to have like what we call, it's very comprehensive, take care everything at once. Don't have to. Just start with one small pattern at a time. So you'll be amazed to see how much you can help. So chemotherapy and TCM, so that's what we are talking about. So basically, this is just a little like example, what chemotherapy can do. You look at what is the DNA in TCM language? Essence. So if you damage the DNA, you damage the essence, kidney essence. So that's what we want to share. That you have a toxin chemicals, cytotoxic, those toxin. The damage that can go all the way deep to the DNA level to damage essence. So essence deficiency or essence deficiency with toxin accumulation. So that is always the concern. So like, okay, do we have it? And for example, patient undergoing chemotherapy. It's dark and it's like it's dull look. And so that is this is what I call that always the chemo face. From TCM perspective, it's cold and it's a toxin accumulation. When they go through. So after a few months, so like after the chemo, you treat it, that has a complexion changes. Yeah. So that's, you see, we want to see more color, red, more natural, red color. So that's, you can say, oh, the qi and blood is coming back. Yeah. And so that's how that works. So basically, the chemo, there's challenges with the chemotherapy. Damage to normal cells. Yeah, that we know. The chemo is not just to kill cancer cells, and normal cells also can be killed, damaged. Yeah, and so one thing is, people may ask is like, why is always the hair, right? Hair loss and the GI tract and also bone marrow. Yeah, because the reason is all the chemo drugs, cytotoxic agents, so they kill fast-growing tissue, fast-growing cells. So hair, the GI tract, the lining, inner lining, the epithelial, layer, and even bone marrow. Yeah, so those are, and also the nerve ending. Yeah, so those are the fast-growing tissue, growing cells in the body. Yeah, so that's why they have been targeted all the time. Yeah. Organ toxicity, the liver, the kidney, that bone marrow we mentioned earlier, and you may also have a chemo resistance or the insensitive cancer. Yeah. The chemo resistance, which is also a common thing. Yeah, you hear the patient, oh, the first round, everybody's happy because they checked, the tumor is 50% shrunk. Second round, not much. Yeah, a little bit improvement. Yeah, round 3, no change at all. Yeah. So when you hear that, so that basically means they already hit a condition called multiple drug resistance. Yeah, which is basically the term used to describe, like a chemo resistance. And if you know that particular chemo is very, very effective to that particular cancer, so normally what we do is help the body to break that resistance, help the patient to finish the chemo. So most times, that resistance, the concept is damp, too much damp, too much like water retention. So you need to tonify qi, nourish, tonify yang, and promote urination, and basically reduce that fluid retention. So that way you can basically increase the sensitivity and they can finish chemo. So that's one approach we also use, that it's not just for the side effects, actually for that MDR, multiple drug resistance, and we have that. So, the recurrence, there's a lot of chemo. Even after chemo, we have patients is like maybe 1 month, 2 months after, the cancer come back right away. Yeah. So those are the challenges, with chemotherapy. So, we can pretty much look at it from different angle to add the Chinese herbs into this picture. So the benefit of the integrative oncology, you can repair the tissue damage, support the normal function. Basically, we focus on the 热湿气, detoxify organs to speed up the toxicity out of the system, reduce side effects. Yeah, so the faster, the sooner you get the toxins out, it's better. And the people always ask, it's like, okay, so how long will the chemo drug, stay in the system? If you ask a doctor say, oh, maybe 3 months, 6 months. In reality, much, much longer. We have patients with the peripheral neuropathy 3 years after the chemotherapy. Yeah. And 2 years after, they still have that look. Yeah. They still have the chemo brain. Yeah. So that means, those residue from the chemotherapy can last way longer, in the system. And so that's like so try to minimize recurrence. Yeah, so this is if you use both, and also So one very important, prolongs and improves quality of life. And chemo can be very harsh. Have patients come in, it's like, okay, there's no appetite, there's no energy, there's just, very depressed, after acupuncture treatment, after taking herbs, appetite is better, mood is better, more energy, and so talking about the quality of life. So that if you do it right, big difference. So that's what we always need to focus. So the TCM definition of chemotherapy is like, okay, how do we look at? So in general, chemotherapy is considered as the cold toxin. So how, you may ask, like, how do we know it's the cold toxin? The basically based on the impact, how the body, reacted to chemotherapy. Fatigue, feeling cold, no appetite, poor appetite, loose stools, diarrhea, hair loss, and pain. So all that, it's like when you have a cold pathogen, cold toxin attacking the system. And so to make it very simple, so there's basically two areas, chemotherapy damages pre-heaven as well as post-heaven qi. So pre-heaven, kidney, post-heaven, spleen, stomach, middle jiao. So that's kind of like make it easier to understand. And so, but everybody's different. Who can benefit better, meaning has less side effects from the chemo? If you have a yang type of constitution, what is the yang type of constitution? Mao yang, Mao qi, and you could have that, right? So they can tolerate chemotherapy better than the others. So this is so sometimes we can just you look at the patient. It's about we do the pre-chemo care, and you look patient. You say like, okay, this particular chemo, because you pretty much know what they're taking, and with their constitution, okay, you can probably have a relatively easier time. The other patient, look at the face, you feel the pulse, it's like all deficiency, is going to be trouble. So you can, but that evaluation, what we have also give you ideas like, okay, what need to do before the chemotherapy start. It's like, oh, we have 2 weeks, let's boost the qi, let's boost the yang, if you see the deficiency. And if you see they have a yang type, too much heat, actually cooling, so you kind of like slow the system down a little bit, so that way they can be more resistant to the chemo treatment. So they, as a cold toxin, they can weaken the constitution. We talk about the DNA damage, all that part. They can affect the zangfu function. The zangfu function, there's long list. The liver, the kidney, the heart, and lungs. Long list of it. And also it causes inflammation. Inflammation is like the chemotherapy, because of the chemicals, toxins, they induce the body naturally have the tendency to fight it. So that as a result, that is the inflammation. So weaken the constitution, we're talking about, it can deplete basically the original qi, called the yuan qi. Consumes the yin, damages the qi and the blood. So this is basically the bone marrow suppression or repression. And so because that's where the qi and the blood generate. So you kind of like you suppress the bone marrow function. You have a long lingering problems. The consequences is bad. So fatigue, exhaustion, tiredness, excessive sweating, even mental exhaustion. That's all from not enough qi, not enough blood, not enough essence. Because normally, the body requires certain level. And because of the chemotherapy, there. So now we talk about the organ damage from the chemo. So the most common, cardiac toxicity. And after chemo, they have shortness of breath. They have the chest tightness. Even palpitations, And the most common, a couple we use, one is 生脉散. Yeah, so this one, remember, it's a very good one because 生脉散help to improve literally the heart, the muscle, as well as the inner lining. So the heart qi refers to the heart muscle, and the heart yin refers to the inner lining. Yeah, 生脉散 can help with that. And by the same token, all the other issues. Yeah, so when you try to strengthen the heart a little bit, you want something not too harsh, not too strong. Yeah, 生脉散 can do it. Yeah, and the side note, 生脉散 is also a very good formula for it's an anti-high altitude sickness. Yeah, so it's like when you go very high, you got the altitude sickness. Yeah, 生脉散 is the one to prevent and to treat of that one. Yeah, so 炙甘草汤 is another one that we use, basically to take care of the heart. Yeah, so that's 炙甘草汤. Because one of the chemo drugs, they're specifically cardiac, toxic. Yeah, and so both formula can be used to address that. So the renal toxicity, the kidney part, that is, there are different level. You need to evaluate if there's issues with water retention. So sometimes after chemo, it's like, oh, edema, lower leg edema, feel cold, and so that we use the combo 黄芪四君子汤. 四君子汤 for gentlemen, right? The qi tonic formula plus 黄芪四君子汤 traditionally is used to tonify kidney qi. Yeah, so this is like, if you haven't used that, try. This is a traditional approach. Yeah, because 黄芪 help to tonify defensive qi, 胃气. So胃气originate from the kidney, right? Got nurtured in the spleen and stores in the lung. So that's why traditionally 黄芪四君子汤 is to tonify kidney qi. And plus 五苓散, help. Yeah, 五苓散we call the herbal diuretic. Yeah, to get rid of because by doing that you can speed up the kidney function. And so depends on it's the yin and the yang deficiency. So 金匮肾气丸 has its place if it's the yang deficiency. 六味地黄丸 if it's the yin deficiency. So that's for strengthening, tonify kidney function. So this is pretty much the three area you need to work on. So the GI disturbance, so this is pretty much nausea, vomiting, abdominal pain, distension, all that. And so first thing first, 生姜, ginger. So this is the one, for nausea and also for mild GI disturbance. Ginger is the one. What do we need to do? Couple ways. Ginger tea, right? Fresh ginger, clean it, slice it, bring to boil for 5 minutes. No more than 5 minutes. This is actually from study. One of the active compound in the ginger destroys more when you cook it longer. So 5 minutes, you preserve that essential oil actually is from ginger. That compound help to stop nausea the most. So that's why you can make a lot. Put it in the fridge. And so you don't. Another thing is like you don't have to drink everything at once, right? Sip it through the day. So that is one. And the other way is, the nausea is really severe. You want to just get it controlled quickly. Slice the fresh sliced ginger slice, suck on it. And the patient will have immediate relief. The nausea is subsided, they feel better. So you can do it that way. There's also ginger capsules, like in my practice, we use that too. And besides that, 藿香正气散. This one most people already know how to use it, but it's a great formula to take care of the GI issues under chemotherapy. It's from no appetite, nausea, diarrhea, abdominal pain, all GI problems. Yeah. And so after, yeah, so it's like a post chemo. Yeah, it's not just, they feel, yeah, it's not diarrhea. It's not, just don't feel right. Yeah, a little bit congested, a little bit bloated, feel cold. Yeah, just no energy, no appetite. We use 香砂六君子汤. 六君子汤, 6 gentlemen. Yeah, plus 木香 and 砂仁. So this is like, you have spleen qi deficiency. You have a little bit of cold accumulation. Yeah, you have a little bit of yang deficiency. Yeah, so 香砂六君子汤 is one. And if it's bloating, sometimes after chemo, it's just bloated. Yeah, they try enzymes. They try, just keep. Yeah, there's no diarrhea. There's not just bloating. So what do we use? 平胃散. Yeah. So this is for talking about distension, for bloating. 平胃散 is the best. Yeah. And 桃核承气汤 is like in rare cases, like I mentioned earlier, if there's constipation, yeah, you need to purge. Yeah. After all, yeah, stomach, large intestine are considered as full organ. So full organ needs to be emptied all the time. Lung damage, yeah, so pulmonary fibrosis, dry cough, yeah, and there's 2 formulas that 沙参麦门冬汤 and 麦门冬汤. So normally lung cancer after chemotherapy, because in lung cancer, the most common pattern is the lung qi and the yin deficiency. Yeah, with toxin, phlegm, blood stagnation. That's depends on what other. So the general pattern, yeah, for that, 沙参麦门冬汤 and 麦门冬汤, either, yeah, it's very, very good. Very, very useful. So we're talking about the neurological toxicity, peripheral neuropathy. Yeah, that's the common. And the 2 formulas actually you can use. One is 当归芍药散, yeah, the other is 桂枝茯苓丸. So 当归芍药散, both of them, traditionally is used for gynecological issues, right? 桂枝茯苓丸, especially, that's fibroids, yeah, and the 当归芍药散 for abdominal pain, yeah. But in treating post chemo, yeah, conditions like neuropathy, peripheral neuropathy. So what you have, the pain is sharp, fixed, there's blood stagnation, and also you see the color. Second is fluid retention. Any inflammation, like the irritation after a while, so that actually you have increased fluid, yeah, like a congestion. So how to remove that, reduce that congestion, and to be able to reduce the inflammation. So both 当归芍药散 and 桂枝茯苓丸, yeah, can do that. So if you haven't tried, yeah, this is something you can try. Because 桂枝茯苓丸 also, both of them, I use that a lot for people with tennis elbow. Yeah, so that's it's the same mechanism. Yeah, blood stagnation, water retention. Yeah, the same treatment. So for liver damage, hepatic toxicity, and this pair, yeah, this is not the common pair, but this is a very good combo. You need to use them together. 小柴胡汤 plus 五苓散 to protect, improve liver function. Yeah. So this combo we use a lot for other conditions like fatty liver, yeah, fatty liver disease, and like people with chronic hepatitis, yeah, and even, yeah, high cholesterol. Yeah, because the one thing I need to point out is like 五苓散, we mentioned earlier. I say, oh, give a name. This is an herbal diuretic, but 五苓散, in fact, is also a great formula to protect liver function. You look at the 五苓散, the makeup, that is actually for liver function. Yeah. And in Golden Cabinet, under Jaundice, the chapter of Jaundice, there's a formula called 阴沉. When they have jaundice, it's called the yin type of jaundice, meaning not bright yellow and dull look, dark look jaundice, they use a formula called 阴橙五苓散, meaning 五苓散 plus one herb 阴橙蒿. So for that jaundice. So now you know that actually is where it's from. Yeah. And in reality, in practice,五苓散is used a lot to address the liver, to improve liver function, by pretty much actually from conventional medicine point of view, by changing, or regulating the lipid process, lipid metabolism. So basically that's why we have a high cholesterol, for the fatty liver, which is most times that's what it is. And use this combination can help with that. I also like to use this combo for liver damage from alcoholism. Over the years, too much drinking, and the liver enzymes elevated, liver function is damaged. You can use this one too. So same token, for the liver. Inflammation from chemo. So that is, you have a lot of like heat issues we're talking about, heat and toxin. That the formula we use is 黄连解毒汤. And so in short, it's like, okay, when the general, like to prevent the cancer from having cancer, it's like, okay, we need to to detox and to increase the righteous qi. The detox part, 黄连解毒汤, that is the most commonly used formula. And to increase the righteous qi, that will be the next formula, 十全大补汤. Let's see, talk about, okay. So when it comes to the compromise the immune system, from chemo, so now you know that there's the two different ones, the T lymph cell, the B lymph cell. So the T lymph cell, which is basically the most important, NK cell, the natural killer cell. And all the studies showing is like, okay, this particular supplement, that particular drug, help to increase natural killer cell. And in TCM, those are qi tonics, 黄芪, astragalus, 人参. Those are the best. To regulate immune system in general. So like, okay, besides that, you can both T cell and B cell. That is 补骨脂, 女贞子, besides 黄芪 and 人参, 补骨脂, 女贞子, and 黄精. There are quite a few herbs that can do that. So just in short, I like to use the TCM language, right? T cell is pretty much more like the qi and the yang perspective in TCM. The B cell system is talking about to generate antibodies. It's like the yin and the blood perspective. So that gives you the idea, if you want to tonify more specific, the T cell, more qi and yang tonic. You want to strengthen the B cell system, yin and blood tonic. So that's just like a very simple way, to look at how to address those issues. So bone marrow repression or suppression from chemo, that's what we look at, the qi deficiency, blood deficiency, because that's where they generated. And we can use 当归补血汤, use 圣玉散, and I like to use a lot is 归脾汤. So 归脾汤 also take care the anxiety, with the cancer patient, they have a very common condition called scan anxiety. This is like every 3 months for the checkup. We have patients for 3 days, 5 days, even a week prior to that date, they get anxious, they get panicky, they cannot sleep, they get irritated. So what we use, 归脾汤, to help calm down. You can do both, to help tonify the qi, nourish blood, same time, calm the shen. Yeah, so they feel better. Okay, so this is my contact info. If you need to reach me, and also I'm always available for patient, consultation and all that. Yeah, I have. Let me see. Let's see if we have. Oh, okay. If you have any questions. Any questions? Let me see. Open up this.
Okay.
Okay.
Doctor, when someone asked about acute leukemia.
Leukemia. Okay. Leukemia is more considered as like toxin in the blood. Yeah, and also heat toxin. Yeah, in the blood. Yeah. So the actually there's a traditional formula we use. It's called the Qing Huang San. Qing refers to Qing Dai, indigo. Huang refers to Xiong Huang, realgar. That. So Xiong Huang is not available. So just use Qing Dai. Qing Dai is the one that cool blood, detox. That's kind of like the best cleansing herb for the liver, heat toxin. So make sure you use that. And another herb also they use is Huang Lian, for that purpose. So there have been, I'm not sure if the clinical trial is finished. They use the extract from the Qing Dai to treat the leukemia. This is started from probably the late 70s, like in China, but they do have clinical trials. Yeah, I think that last time I heard is in the States. Yeah, but I haven't seen anything, recent. Yeah, so that is the one.
Do you use only herbs for chemo damage, then acupuncture for general symptoms?
Now you use combo. Yeah, because acupuncture and the herbs have different roles, right? Yeah. For example, like the peripheral neuropathy, acupuncture probably do more. Yeah, needles but speaking of that, is like, okay, if you combine with, I use herbal soak in my practice. So just the patient, there's no need to take it internally, just the soak their feet or hands, half hour, 45 minutes every day. Within a few days, you can see the big difference. So acupuncture you can do very locally. Yeah. So the combination, is always always the best. Yeah. But some type of cancer, the acupuncture can do more than herbs, and vice versa. Other types, so like herbs can do better.
For patients who have had radiation with chemo, will you see more damage from cold?
Damage from from chemo, you more likely to see cold. From radiation is considered as a heat toxin. So you see two things. One is you may see like fluid deficiency or indeficiency, so that come with the heat. The second is you may have the lingering from the radiation, which is also considered heat, like a heat toxin. Yeah. So that's the reason you may look at, from radiations like locally, right? You see the skin that's red. There's can be, sometimes even can be like a burned like, yes, like a heat toxin damaging that area. Yeah. So when you do both, some people they do radiation therapy and chemo at the same time, but they do like half chemo. That's the most common. Yeah. And so you can see the funny thing is like, because the cold toxin and the heat toxin can cancel each other out a little bit. They don't show as much, but some people, that's actually the, cold toxin plus heat toxin, they cannot even tolerate. Yeah. So you do see different, the presentation.
If chemo makes the patient extremely cold, can we use warm herbs?
We always use warm herbs. Yeah, so that's the key. And because, now actually we look back from TCM perspective, it's like what causes the cancer. All the theories, stagnation, that is what we see, but that is not the cause. So the real cause, and I personally, I think it's two things, right? One is yang deficiency. The second, cold toxin accumulation. So the cold toxin accumulation, like chronic inflammation, and the cold, the yang deficiency, that could be your adrenal function, your thyroid function, your general immune deficiency. So it's beyond. It's not just like the immune system, weakened. It's beyond that. Your other, what we call the yang energy, the adrenal gland, the thyroid gland, also involved.
Okay, what do you consider B-cell lymphoma, high lymphocyte count, and enlarged peripheral and abdominal lymph nodes?
So that is in general, when you see that type, anything in the blood, phlegm. So if there's, it's like a toxin and a phlegm combination. But at the same time, you may see blood stagnation, you may see qi stagnation. And so this is but toxic, like phlegm combo, that is for lymphoma, all kinds of lymphoma. That's the key.
Nutrition-wise, what kind of food or diet do you recommend to use or to avoid?
So normally we tell the patient, okay, as long as it's not sugar, not alcohol, when they go through chemo, that's fine. They're fine. You don't have to be very careful about. We have patients like, okay, the nutrition is that you cannot eat this, cannot eat that, so they end up eating, eating nothing. No. When you under chemo, so we have to have a focus because you need nutrient. So anything you can eat it, as long as it's not sugar, because that we know sugar, just makes the cancer cells grow faster. Alcohol, same thing. Alcohol turn into sugar, and that do the same job. So that's pretty much after chemotherapy. So then you can go back to get started, what their pattern look like, so that you can come up with a more individualized plan.
What is the best food or herbs for clearing toxicity?
If you only pick one, lemon water. That is the natural. Lemon water is actually alkaline, right? Help the liver to cleanse. And the less toxin you have in the system, the less chance you have for developing into cancer. The period.
Can you comment on colon cancer?
Okay, colon cancer from TCM perspective is considered as the spleen kidney, more like spleen kidney yang deficiency with toxin accumulation. But there are different types. For women, for most common for young women, they have colon cancer. Most of them have a history of chronic constipation. So that type, they started from like a very young age, to mid 30s. They already have over 20-some years of constipation. That is the toxin is the major. So the elderly and the small yang deficiency, because of this, also the slow movement, the peristal movement. So you have more toxins reabsorbed back into the system. So like yang deficiency and the toxin accumulation.
Do you have any recommendation for specific references for this topic?
If you're interested, for you mean for just for the colon cancer or for the general?
General.
General, okay. So if anybody, anyone's interested, I already had a CEU class a few years back, like TCM, integrative oncology, like 6 parts. Yeah, that was a couple years back. But I have that on my website. If you're interested, you can just check out my website and yeah. So that, and also we're planning, to have a little bit like more like advanced like TCM oncology, in the next couple months. Yeah. So just talking about the more like individual, the kind of like breast cancer versus lung cancer, colon cancer versus brain tumor, that type. It's coming. But if you're interested in this topic, that I have that 6 parts of TCM oncology.
Could you talk about how bone broth? Can you talk about bone broth to replenish red blood cells?
Well, the bone broth, from TCM perspective, right? Tonify kidney essence. Yeah. And, that's even from Yellow Emperor's book, where's the qi and the blood from? The qi and the blood, especially the blood, one part is from the essence from kidney. So the other part is from nutritive qi. That's basically, the post-heaven, what we eat. So bone broth is a very good way to stimulate kidney essence. Yeah. So that's why it's like to strengthen the immune system. Instead of taking supplements, bone broth is a good way to go.
Okay, last question. How do you get the MDs to approve using herbal formulas? My patient runs everything by her doctor, who then asks the pharmacist, who says no since they don't understand.
Talk to the doctor, not the pharmacist. And a lot of doctors actually they have a list of the herbs that they think is not safe. Yeah. And but in general, this is where the communication is like, okay, so first thing first, the talk is like, they're on chemo, you don't have anything in the herbs that act like chemo. That's number one, always number one. Number two, the herbs for the immune system and also help to, the GI support, whatever that particular patient may have. Yeah. And so this is the way to talk. Yeah. The thing is like, if the doctor approves the patient take supplements, which most people do, if they can take 10 different supplements, they can actually take the herbs much, much easier.
Okay, thank you, Dr. Wen, for answering the questions. We know you have a very busy schedule, so thank you so much for joining us today. And thank you, everyone, for attending. The lecture notes are available for download on today's webinar's the Blue Course Access page. So a lot of you were asking about the last slide. You can download the lecture notes, or you can watch the recording of this class, which will be available starting tomorrow afternoon on our TCM Wisdom Tube or our YouTube. That is it for today, everyone. Thank you guys so much. We hope you enjoyed the class, and we'll see you at our next webinar. Bye.
Thank you.